Welcome all to our next fireside chat for PubH 610, Leadership and Management. I'm Cesar Lopez. I'm one of the professors teaching this course along with my colleague, Professor Lily Warren. We have a very special guest today. By way of introductions, Dave Choksi is a practicing physician and a public health leader, is currently the Sternberg Family Professor of Leadership at the City College of New York. Dr. Choksi previously served as the 43rd Health Commissioner of New York City. From 2020 to 2022, he led the New York City's response to the COVID-19 pandemic, including its historic campaign to vaccine over 6 million New Yorkers. Earlier, he was the inaugural Chief Population Health Officer at the NYC Health and Hospitals, H&H, the largest public health system in the nation, where he also served as CEO of the H&H Accountable Care Organization. Dr. Choksi has practiced primary care internal medicine at Bellevue Hospital since 2014. He has held successive senior leadership roles that span the public, private, and nonprofit sectors. A Rhodes Scholar and a White House Fellow, he is nationally recognized as a transformational leader, a clinical innovator, a policy expert, and an advocate for a stronger and more equitable health system. We are very fortunate to have Dave Choksi join our classes today. Our students are excited to learn more about your experience as a public health leader. So let's get started with our first question. On the topic of innovation, looking ahead, what is your vision for the future of your area of work or research or interests?
Yeah, well, first of all, thank you, Cesar and Lily, for having me. It's always just a genuine pleasure to get to spend some time, even asynchronously, with CUNY public health students. And I always have to start by saying it's such an important and momentous time for those of us who care deeply about health. There are some challenging reasons for that, in the wake of the pandemic, with stagnating life expectancy, with backlash against racial justice priorities, but there's also a lot to be excited about. And so, I think we'll explore on both sides of the coin some of my thinking there. And let me pick up your question, about the vision for the future. I think, the way that I would summarize it is that we have to challenge some of the silos and ruts that we find ourselves in when it comes to our discourse about health and what needs to change about our health system. So what do I mean by our discourse and our ruts? We saw during the pandemic what we were capable of when the invisible walls that separated, different boundaries in our health system disappeared. For example, you heard that I've worked, in a healthcare system, and I also worked at the public health department. In each of those cases, I always felt like I was sort of the guy from the other side, at the healthcare system, at New York City Health and Hospitals. I brought a very public health mindset. I talked about denominators. I talked about drivers of health. I brought a very data-driven approach to the work that we were doing. But then reciprocally, when I was at the health department, I thought there was a lot that we had to learn about healthcare and the way that healthcare did things to be much more accountable to the people that it was serving. Healthcare is generally thought to be more operationally focused, than a health department is. And I think there's a lot, to be learned from that side as well. And so, the vision that I have for the future is for those halves to come together, for us to be able to better, weave together, often behind the scenes, the way that healthcare and public health can improve the health of the people and the communities that we're serving in a way that feels seamless to, to my patients or, to any of the New Yorkers whom we're serving from the health department's vantage point as well. So that's, one piece of the vision for the future. I recently started an initiative called the Common Health Coalition, which is really dedicated to that mission of integrating and, more tightly linking together healthcare and public health. We can talk a little bit more about that. But then the last thing that I'll say is that, my vision also has to do with like what I think of as almost like jumping the ruts of our discourse. In the United States, if you think about what our political dialogue is about health, it is often so myopic. When you think about how health is discussed in the presidential campaign, or even how we talk about health around the kitchen table with our family members and our neighbors, it is often very narrowly focused on health insurance policy. Is someone deserving of health insurance or not? Should we expand Medicaid or not? Should there be a public option? Should we repeal and replace the Affordable Care Act? Should we move to Medicare for all? And I think these are important questions, of course. And, I'm a supporter of moving to universal health care. But I also think that it takes so much oxygen out of the room to have this narrow focus on health insurance policy rather than expanding it out to healthcare policy, which would be broader, of course, than insurance. But then vitally for us to actually get to health policy, which would encompass all of the things that we care about as public health practitioners, but also require partnerships with colleagues in many different sectors, for example, housing and education, and all of the things that actually generate health beyond illness in the first place. So those are a couple of sort of fundamental aspects of my vision.
Lily, did you have any follow-up questions about that?
I love what you just mentioned, the transitioning from a focus on health insurance policy to healthcare policy to health policy. I wonder, do you feel like in some ways things are moving in that direction? Or is this sort of a vision, a faraway vision for you?
I think it is a medium, to long-term project. For example, I don't think that in the presidential election in 2024 that what I think of as health policy is really going to get a huge amount of airtime. But I'd say a couple of more things. One is that we did see some of this during the pandemic. Beyond what we were able to accomplish with respect to the vaccination campaign and some of the mountains that we moved in terms of public health being able to save lives during the pandemic. We also saw how, for example, we could house people who were homeless. We moved huge numbers of our fellow New Yorkers who were experiencing homelessness into either temporary or more permanent housing, even though people said this was logistically impossible. But we found a way to do that when we needed to. At the national level, we halved the child poverty rate through the child tax credit, and other targeted investments. Because we knew that economic support was really vital, given the economic dislocation that the pandemic had. So, one of the things that I've been talking about is how, as people sort of move beyond the pandemic, and let me be clear, everyone is tired of talking about COVID, myself included, but part of the opportunity cost of that is we're throwing the baby out with the bathwater. We're in our collective amnesia, we're forgetting those big things that we were actually capable of in a time of great duress, a time of huge tragedy in New York City and across the nation. And so I do think we have to channel that experience when we think about what we need to accomplish going forward, because otherwise it can feel very paralyzing to take on these big issues, child poverty, homelessness, the gaping life expectancy gaps between Black Americans or Native Americans and white Americans. But when we sort of look at it from the vantage point of what we were able to accomplish during a time of great need, it gives me more hope for what we can do going forward.
I'd like to follow up on something that you talked about a moment ago about being, your words, like the guy on the other side. I imagine that some of our students might feel like they could feel like that in a professional setting. Either they're the MPH student or MPH grad in in a in a private sector setting, or they're the health expert and they're trying to work on something else like housing, although there's a lot of connections there. What advice would you have for people that starting off in their career and are feeling like they're on the other side?
Yeah, I mean, my first piece of advice is to approach it with humility. I've worked with a lot of CUNY public health students now, and so I think this comes naturally to to many folks that I've been exposed to. But that, the tenor of humility matters a lot when you are trying to build bridges, or when you're trying to, what I think of as, infiltrate sometimes. I often felt like an infiltrator in the healthcare system where, there were some things that I thought needed to be done very differently. And that was my motivation, to work within a healthcare system. But when you start with a note of humility, it means you start by asking questions, not by coming with all of the answers. You start by saying, hey, there's something that you have experience in that I need to learn, because I haven't been steeped in this environment, for as long as you have. And it makes people much more receptive to the ideas that you may have to then reform or change things down the road. I found like one of the most concrete ways of doing this was to make sure that I always knew what problems my colleagues were trying to solve, rather than the problems that I thought they should be solving, and then doing the extra work to build the bridge to what I was passionate about, or what I thought would have the most impact, and how they actually linked up with the problems that my colleagues themselves wanted to solve. We talk about health in all policies often in public health, but I can tell you, as health commissioner, if I called up the transportation commissioner or the education chancellor and I said, hey, let me tell you about health in all policies and why you should be doing X and Y, the transportation commissioner would say, hey, let me tell you about transportation in all policies, and why you should listen to what I think we should be doing around bike lanes or traffic safety or whatever it may be. And so it really matters to be able to like put yourself in the mindset of solving the problems that people are already grappling with, because it just makes you, much more effective in that way.
Thank you for that. That's really helpful. Lily, over to you for our next questions.
Thank you, Caesar. And thank you, Dr. Choksi. That was really, really interesting. Okay, so moving on to a question about leadership. So we know that you've served in leadership positions in multiple different settings: hospitals, city government agency, academic institution. Reflecting on these different experiences and roles that you've had in the field of public health or healthcare, which of these settings, in your opinion, has offered you the best environment to be able to accomplish your goals as a leader and provided the most solid framework for you to be successful as a leader?
Yeah, well, I know that the title of this course has to do with management and leadership, and so let me touch a little bit on the management aspect of it, because it was so critically important. When I was in the leadership role, particularly in a leadership role in a time of crisis, during the pandemic when I served as health commissioner, to be able to arc back to some of my experiences growing as a manager. And so the phase that I'll tell you about in my career is the 6 years that I spent at New York City Health and Hospitals, which I'm sure most of your students know, but is the public healthcare system for New York City. It spans 11 hospitals, places like Bellevue, Kings County, Lincoln Hospital in the Bronx, as well as over 70 community-based points of care, and is particularly well known for taking care of people who are uninsured or on Medicaid or otherwise low income. And so, I spent a really formative 6 years there. And I just want to tell you about one piece of my trajectory, which was the sort of successive responsibility that I had for leading and managing teams over the course of that 6 years. I used to say I started with a team of 0, but someone reminded me that I was on my own team. So I started with a team of 1, and then I was given more responsibility around primary care transformation. I had a team of 7 people. And then I sort of grew that by adding on some population health responsibilities as well, chronic disease prevention, care management, social determinants of health. And so then I grew the team from 7 to 70 people over a couple of years. And then over my last year and a half, I grew the team from 70 people to 700. It's just happenstance that these are all 7 numbers, but I went from 1 to 7 to 70 to 700, over a period of about 6 years. And I learned so many hard-won lessons, over that period. I learned about the difficulties of hiring and firing and how, the people decisions that one makes are the most important decisions, even though we might agonize over some substantive, thing that we're wrestling with. It's really the people who you choose to surround yourself with and put on your team and reward and promote and and remove from the team that make the greatest difference, in terms of what you're able to accomplish over the long term. There's also a transition, particularly when I went from 70 to 700, where all of a sudden I couldn't actually know the names of all of my team members, nor all of their portfolios. It just was, maybe for someone more intelligent than I am, that is possible, but you just aren't able to keep track of it all anymore. And so you have to learn how to let go a bit, but more importantly, you learn to focus your energies as a leader on your people. For me, it was supporting my deputies, making sure that when they were wrestling with problems, they knew I had their back. Because we were in a large, complex organization, figuring out how to block and tackle, for them. And, serving as a coach, as someone who, could give them feedback and really, lift them up and inspire them, in the instances when, that felt genuine to be able to do. And these are things that you can learn a little bit from, coursework or from reading, but there's really no substitute for rolling your sleeves up and actually, getting that experience in the first place. I find that too often people, sort of shy away from that management responsibility, both in terms of people as well as budget, instead of embracing it and saying, this is a really critically important part of my, developing as a leader myself. And there are just like a couple of other lessons, that became very crystal clear for me that I then relied on, when I was in an even bigger leadership role. The health department actually happens to be about 7,000 people. So I went from 700, to 7,000 people when I started serving as health commissioner. And so the couple of other lessons that I'll just touch on briefly is, particularly in academia, we prize clever communication. If you have an original formulation of things, or you have like the right answer, or a clever new way of looking at things, that's what kind of rises to the top in an academic setting. What I found when you're actually trying to get work done in the real world, and particularly again in a large complex organization, it's less about clever communication and it's much more about repetitive communication. Being willing to say the same thing with genuine passion over and over and over again, in different settings, and having the conviction to do it in a way that is authentic, that people can feel why you believe in it so strongly, and to do it, in your own, cabinet meeting, and then going to an all hands meeting, and then meeting with a community group, and, saying the same message over and over and over again. That's what really moves the ball. When you're trying to wrestle with really complicated, problems in the real world. One aside that I mentioned is this is why you often see narcissists ascend to positions of authority, because think about who doesn't mind hearing themselves say the same thing over and over and over again. And, it tends to be narcissists. So we don't want narcissists, in all of our positions of authority. So that means, if you're not a narcissist and you want to change the world, you actually have to develop the muscle to do this repetitive communication. And what I think of as nourish your convictions in a way that that allows you to speak with passion, in multiple different settings, hammering home a message that you care about enough that you're willing to, even if it feels nauseating to you, like, look, I know some of you saw me during the pandemic on TV, spreading the word about vaccination. If you got tired of hearing me speak, like, just imagine how I felt hearing myself say the same thing over and over. But I knew it was supremely important, for the mission that we were serving. And so that's another really important skill that I feel like I, was able to develop as I moved through those 6 years at Health and Hospitals and tried to build my management capacity.
Thank you so much for sharing that. I have one follow-up and then I'll hand it over to Caesar. You talked about how some of your communication strategies evolved as you moved to a more public-facing role. What else would you say you learned about your strengths and maybe areas of growth as a leader during your tenure as the New York City Commissioner of Health, where you really were a public, I mean, some might argue political figure? How did you, what can you share about that?
Yeah. Well, let me start with the strengths, because that's an easier one, and then I'll go to, areas for growth. But one of the things that I sort of realized is that some things that I took for granted about my own sort of temperament and disposition. I'm someone who's a natural listener. I've always really enjoyed reading fiction, and I sort of tongue in cheek when people ask me, like, what's the most important thing to do to become, to like be in a political position like that, I'm like, read novels, and it's only a little bit tongue in cheek, because I really believe that imbued me with the ability to perspective take, to be able to very rapidly shift into someone else's mindset and see the world and understand, how they're sizing things up from their perspective, which when you're dealing with colleagues at City Hall or in the governor's office, or elsewhere in positions of great authority for the things that you're trying to accomplish, you need to be able to very rapidly shift and perspective take so that you can, again, like, help them to solve their problems. But in order to help them solve their problems, you have to know what those problems are from their perspective. And so, a lot of the things that I think I love about practicing medicine and being a doctor, again, listening, sitting with a patient, like understanding things from their perspective, doing so in a pretty non-judgmental way, and then kind of layering on what I think should happen to improve their health, but in a way that is guided by them. Bringing that into the political arena, ended up being like a little bit of an unexpected source of strength for me. So that's one. In terms of areas of weakness, let me see if I can narrow it down. There are a few ways that I realized I had to adjust my leadership approach. One is that I'm very naturally deliberate. I like to have all the data. I was trained as an internist, and I know some of your students are doctors. The stereotype of an internist is we're the like pointy-headed people on rounds who love to get more information, run more tests, have long differential diagnoses of potential things that could be going on with the patient, and to talk about it, for hours on and hours, to try to get to a clarified thinking about the right path forward. And there just wasn't time to do that, when you're moving at pandemic speed. And so I went from having to be a very deliberate decision maker, someone who prided myself on being a servant leader who would often like sort of evoke what my team members wanted to have happen, lift that up, and sort of empower them to move that forward, to being someone who had to make more decisions based on instinct and really trusting my instincts, to do so. And also in some cases, just because speed is a virtue, particularly in a time of crisis, but I would argue just in the real world in so many ways, pointing a direction forward for our team without going through the full sort of deliberative process that I would otherwise like to go through. So that was a weakness for me that I had to learn how to shore up very quickly, to move to a more instinctive way of making decisions. And then the last thing that I'll say, in terms of weaknesses, is knowing that there were some weaknesses that I had just bringing to the role of being a new person in the health department, and making decisions about whom to surround myself with in ways that mitigated those weaknesses. So one of my first, leadership appointments, actually the first leadership appointment when I became health commissioner, was elevating Dr. Torian Easterling to be my first deputy commissioner and chief equity officer, because he was very well respected by people at the health department. He had been working on, equity initiatives at DOHMH for years upon years, and had really wonderful relationships, not just inside the department, but outside of it as well, in ways that were really valuable to shore up, some of the places where I, as a new commissioner, would otherwise not be able to sort of move in the ways that I wanted to, because I hadn't had the time to build those relationships. So again, for me, this is a little bit about humility and saying you can't solve everything in one person, regardless of how talented you are. And so have the self-awareness to know what your weaknesses or, sort of down points are, and then find people who are better than you at that and empower them.
Thank you so much. Caesar, I'll hand it over to you.
Those are really honest and great answers. I know our students are going to really appreciate hearing this. I'm going to go over to a new topic, which is an elevator pitch. Our students are working in groups. They've been assigned to address a public health issue. They've chosen either COVID-19 or the drug overdose crisis in assigned states. And one of the final assignments that they're going to do is to deliver an elevator pitch to a theoretical governor in their state about a program or a policy intervention. So this is something that they get to practice in a classroom. The opportunity to do this in real life may or may not present itself. So we wanted to ask you, when you get pitched an idea by someone, what are you looking for? What makes an elevator pitch effective for you?
Yeah. Yeah, I'm just thinking, because I'm trying to boil it down a little bit. And first, let me just say, I love that this is a part of your course. This is so, so vitally important. And I can't tell you how many times I've been pitched disasters, like things that just don't meet the basic criteria of what you would want for an elevator pitch. First of all, it would be a very long elevator ride for many of the pitches, that I've been subject to. So if I had to distill it down, there are like three core elements of an elevator pitch. The first is brevity, as I alluded to. The second is clarity. And then the third is conviction. So let me just tell you a little bit more about each of those points. First, on brevity, you have to really understand something very well in order to describe it succinctly. So you have to go through the work of writing something out, trying to fit everything that you want to fit in that pitch, and then winnowing and whittling it down to the core elements, that are the most important. And that often takes a pretty significant amount of iteration, for you to be able to go from the big draft, to the short, succinct end pitch. So that's brevity. And remember, the people that you're pitching, they don't have a lot of time in the first place, and they also are being pulled in a million different directions. And so brevity really matters to be able to capture and hold their attention. And that's really kind of the segue to the second part, which is clarity, which also is very important for, holding attention. You can't have like a long and winding road. No one is looking for you to spin a yarn with a punchline at the end of it. I often advise people, like, start with the bottom line up front and try to actually, we do this in medicine a lot. When we try to summarize a patient's case, we call it the one-liner. So I'll often ask, like, what's the one-liner to my team members? So then the brain has something to scaffold all of the rest of what will follow onto that one-liner. And for better, for worse, we're like a narrative species, human beings are. But in the world that we live in right now, like, we're not looking for, that long yarn. We're really looking for something to be crisp and concise and clear. And the other aspect of clarity, other than like having the bottom line up front, is to de-jargonize. And particularly in public health, like, this is such a major problem that we have everywhere. We love our acronyms and our jargon, and we hide behind them in some ways. My favorite example of this is we talk about years of life lost, or YLLs, which should be this emotional, sort of wrenching thing that we public health people are the stewards of. Like, we can save people's lives and give them more healthy years to their life. Is there something more inspiring than that? Like, I am hard pressed to think of it. And then we hide it behind this jargon that we call YLLs, which make people's eyes glaze over. So I talk about birthdays lost or birthdays gained rather than, years of life lost. So that's just one example of making sure that you de-jargonize. A good way to practice is, if your parents are anything like mine, I have immigrant parents, English is not their first language, like, test out your elevator pitch on, a parent or a sibling, or, someone who's totally not in the field. And if they grasp it, then, like, you're on the right track. And some people say, well, the governor's pretty savvy, or whomever it might be, the health commissioner is pretty savvy. But the reality is, if you're able to communicate something in a way that works around a kitchen table, it will work around the boardroom table as well, And so it's much harder to get to that kitchen table version. And you can add a couple of bells and whistles when you have to actually, talk to another decision maker, but start with the kitchen table version. And then the last part is conviction. And conviction matters so much. People will prick up their ears and pay attention if they can feel that you believe what you're talking about. And this is not about putting emphasis in a certain way, or your tone or your inflection. I mean, it's a little bit about that, but it's much more about what is actually in your heart, and what I think of as nourishing your own convictions in a way that you can deliver an elevator pitch with feeling, because you actually feel it, because you have talked to the people that you're serving and understood their struggle, or, you know, you have spent time in a community and seen the devastation that you're trying to rectify. Find ways to nourish your convictions so that that elevator pitch is not an abstraction, but is actually delivered with authentic feeling. That matters a lot for the elevator pitch as well. So brevity, clarity, and conviction. Those are sort of my 3 points of advice.
Thank you for that. That's great advice. Lily, if you have follow-up questions, feel free. If not, you can go on to the next question.
Great, thank you. So in our last couple minutes together, we wanted to end with some guidance from you, some words of advice. So we personally believe, Caesar and I, that a future commissioner, maybe 2, maybe 3, could be a student in our classes watching a recording of this conversation. So what key messages would you like to share? Would you like to leave our students with at the end of this conversation?
Well, I have a couple. I hope you'll allow me. I don't doubt it, you know, whether it's a health commissioner or a surgeon general or, you know, some future leader. I really believe, and this is why I'm at CUNY myself, the people who pass through the halls of the CUNY School of Public Health and places like City College are the ones who should be occupying those positions of authority and those halls of power. That's a problem in our world today, and we all need to band together to make sure that people actually come from the communities that they aim to serve. So, you know, so that's the first piece of it. But then it's about, okay, how do we reach and, you know, actually get into those positions of authority and then have an impact when we're in them. So there are a couple of lessons that come to mind for this. The first is that, you know, what I think of as the idea that relationships are the foundation of all accomplishment. This sounds like pretty simple when you articulate it like that, but I find that it's very commonly lost. Relationships are the foundation of all accomplishment. We think about, you know, funding, we think about policies, we think about clever ideas, you know, we think about organizing, and like all of those are really important. But in my experience, it is about relationships. You know, people will do things, the transportation commissioner, you know, that I was talking about, or your own team members, you know, will be inspired or not based on how much you genuinely invest in the relationships that you have. And every single thing that I've done that's good in my career has been because of a relationship that I invested in and valued, and that we were able to do together, because anything worth doing is a group purpose. So, you know, that's sort of the reason that relationships are so important. So you will encounter many, many different points in your career where you'll make a choice between, oh, should I do something that will help me advance my career a little bit or move forward this project that I care about, but will come at an opportunity cost to a relationship. Always the tie goes to the relationship. And, you know, in many cases, the relationship should trump whatever it is, you know, that you're trying to solve for on the other side of the equation. So relationship is the foundation of all accomplishment. And then the last piece of advice that I'll end with is, in all of the, I don't think you can see it here because it's blurred out, but I have a whiteboard here in my office, and I have a couple of things that I always keep on my whiteboards. One of them is a saying, and the saying is, it's better to light a single candle than curse the darkness. It's better to light a single candle than curse the darkness. And I really believe that you have to keep that front and center in your mind, particularly if you aspire to public service, where it can be very hard. You know, the bureaucracy can be grinding. It can feel like you're not making a lot of progress on a day-to-day basis. There are legitimate reasons, you know, to burn out in those environments. And so keeping front and center in your mind this idea that it's better to light a single candle And almost always there is a single place to start, even if it's one person or one community or one organization. And to figure out, for the things that you care about, what is that single candle? Start there. Don't get consumed by all of the ways in which, you know, you're going to encounter headwinds, and then build out from that single candle to light, you know, other flames, and to do it in relationship with other people. So let me end on that note.
Dr. Choksi, Caesar, and I, on behalf of our students and ourselves, would like to thank you very much for taking the time to talk with us today. Personally, some values I think that you've mentioned throughout this conversation that stand out to me include self-awareness, authenticity, conviction, also humility, and your last points about investing in relationships and thinking about potential opportunity costs of any decisions that we decide to make throughout our career. I will really keep all of those aspects in mind for my own career as well. So a huge thank you, and have a wonderful rest of your day.
Thank you. Thank you, Lily. Thank you, Caesar, for having me. I appreciate it.